I've come to talk about performance optimization in T-squared lab, which I just had a look at your gym and it's phenomenal. So I feel like I'm going to be standing here trying to teach you to suck eggs, but I'm going to try not to do that. And I'm going to try and stay away from medicalizing things too much, okay? And then kind of go back to the basics and theories of training a little bit, okay? And then the second part is really about the injury prevention and, again, some of the theories behind that. So it's really going to be hopefully not too medicalized at all, okay? This is myself. You can see I get bored very easily. And when I get bored, I try and find other things to do. And so I've just finished a pain medicine intervention course, and now I'm like twiddling my thumbs wondering what else to do. So yeah, keep the space open. Just a quick overview. These are some of the things that I do in my clinical practice as well. So obviously you deal with sports and MSK injuries. Ultrasound is a big thing that I do, and I do a lot of different procedures. So I'd say I'm more interventional sports medicine as opposed to just somebody who you come and talk to and examines you and so on. So I say to my nurse that nobody comes back to see me again because I fix them all up, and that's part of the issue that I have. So if you're interested in ultrasound or cases and things, this is a YouTube video I started, YouTube channel I started about 2 years ago. I think it's just gone over 1,002. Some of it's a bit technical, but there's some interesting stuff on there as well. So please feel free to have a browse. I wrote a book a few years ago about MSK ultrasound. So, again, something that I'm very passionate about. But if you're interested in just sports injuries, and if you have clients or anyone who you want to share free information with, this is a free website. No subscription required, no advertising. It's just pure information. There's contributions from physios, podiatrists, dietitians, orthopedics, myself. So lots of different people, and it's just free information. So you can see there's upper limb, lower limb conditions, concussion, different things. So please have a browse. Okay, so let's move on to performance optimization. So we'll divide this talk into performance and then injury. Okay, and so I guess at the very crux of it in sport, performance optimization is enabling the athlete to do what they're meant to do. Okay, whether it's in a team sport, whether it's in an individual sport, it's really to get them to be able to perform at the optimal level. And of course, there's many different factors that come into play, whether it's their ability to exercise, biomechanics is a huge part, and then mental health and mental preparation is important as well. There's two theories that come into play here, and I'm not going to go into a lot of depth on both of them, but the supercompensation theory. Has anyone come across that one before? You have? Okay. So I'm going to be teaching you how to suck eggs. I'm sorry, but everybody else, any thoughts on what supercompensation might be? No? Okay. Energy systems, I mean, this is all like glycogen and ATP cycle and everything like that, so that's a little bit less interesting. That's a bit more kind of biochemistry. But essentially, supercompensation is this, okay? So we have a stimulus here, and under normal training circumstances, you have some, your body is damaged in some way, okay? So there's something going on in the body, but then it recovers and there's an overcompensation, and then you improve your fitness. Now, if the training is too easy, you can see that overcompensation is less, and if the training is too hard, you are at higher risk of injury, okay? Over time, what happens is it's a bit like a cycle. You have to keep pushing to get to the point where you want to aim for, okay? But it's having a balance between here and here. So undertraining and overtraining, okay? And if you hit that sweet spot, that Goldilocks zone, then you will get those performance adaptations. But if you push too hard and don't give yourself enough recovery, or don't push yourself quite hard enough, then you're not going to see the changes that you want to see. And so essentially it's getting that sweet spot between load, recovery and adaptation. And you want to try and find that area, and it's very individual. So, you know, mine will be different to yours and so on, okay? In terms of performance and in terms of physiological adaptations, have you come across the SAID principle? Yeah? You have?
Yeah, I mean, just from studying all the certificates and stuff. Right?
Okay.
Yeah, the body basically will adapt to the forces applied.
Correct.
At one time.
Yep. In sport, though, we try and do it in a very specific way, so specific to what you're going to be doing. So I'll give you an example. If you follow rugby, okay, in the rugby training, obviously, you know, they're throwing themselves against the mats and everything like that. And that's to condition themselves in preparation for what's going to happen during sport. Now, you wouldn't get footballers doing that, right? But on the other hand, you know, if a footballer is tackled and they're rolling around, maybe sometimes we should be thinking about that for footballers as well. So, you know, you have to do stuff that's specific to the sport, okay? And that's why in the warm-ups, you can see, I don't know if any of you follow football or soccer, but you see they start off with the very basic running around, then they do passing drills, then they do, you know, small match play. And all of this is to try and develop that neuromuscular warm-up. And so this is how they also do their training. Okay, so if you've ever watched like a Premier League team train, that's how they build up into their full training into their full training session. Okay. The other thing is something that's very useful in terms of the biomechanics and movement efficiency are using things like gait analysis and using motion capture. Now, this is very useful for optimization of movement. Okay, so take for example golf. Okay, so any of you play golf? No? Have you tried hitting the golf ball before? It's bloody hard. And actually, you know, you're swinging a club which is maybe yay big to hit a ball which is yay big, and you're trying to hit it as far as you can. And biomechanics plays a huge part. You know, is the limitation in the swing, is it in the shoulder, is it in the knee, is it in the hip? And actually trying to break things down a little bit and decipher where the limitation is, where they're not getting that power is very useful. And then finally, things like joint stability, mobility training, you know, these are all important in terms of being able to perform at the optimal. So, like I said at the beginning, I'm not going too much into depth on certain things, but I'm going to try and give an overview of things. So, nutrition and hydration and performance for recovery. So again, I see you have the bar here, okay? So I'm sure lots of your clients and everyone are using the bar afterwards for recovery, okay? Macronutrients and energy, so carbohydrates, you know, fueling enough for performance. So if you're not fueled, you're not going to be able to perform, okay? I'll give you an example. So years ago, I used to work with the under-19 England football team, and before that, these guys would eat a huge meal about maybe 2 hours before the game. And I always used to think, wow, that's really weird, because they eat so much, but they're carb loading for that 90-minute match, because during that half time, they don't really feel like taking on board any extra fuel. And if they're going to be playing that whole 90 minutes at high intensity, let's say they're a midfielder, you know, they're going to be running up and down, and on average, a midfielder runs about 15 kilometers in a game. You know, that's on top of all the technical stuff that they have to deal with, okay? So, you know, sufficient fuel loading beforehand is very important. Protein, it goes without saying, in the gym, you know, essential for muscle repair. But it's important to look at what type of proteins you're also getting on board for muscle recovery, okay? And having those specific amino acids are important. Fats. Now, fats are not our enemy, okay? I know we all try and stick to low-fat diets and everything, But actually, if you look at what you're eating, quite often if something's low fat, it's high sugar, because they have to get the taste in somewhere, okay? So actually fats are quite good, and fats are a normal thing to consume. Obviously, there's certain ones which have better properties than others, such as the omega-3s, okay? But fats are not our enemy, okay? Actually, carbohydrates, you know, the high glycemic ones are probably our enemy compared to fats. In terms of timing, that's another thing that can really impact on performance as well. So what we want to do is, within the first 30 to 60 minutes after a training session, is we want to consume food, okay? Now, for most people, we would say, just go and have a meal, okay? Just whatever you eat normally, just go and eat that within the next 30 to 60 minutes after training. But if you're trying to bulk up, or if you're trying to prepare for something, you may modify the contents of it somewhat. So have more protein or less carbohydrates. If you're trying to cut weight, you don't want to have so much of the carbs and the fluids as well, okay? And then pre-sleep. So during sleep, you're still building muscle, you're still recovering, especially after a very heavy training session. So if you can take on board that you are trying to improve your performance even when you're recovering, okay, you're still trying to build on things, then taking protein before sleep can be helpful as well, okay? The last one of this is hydration and electrolyte balance. And especially in, when we've had very hot, humid weather here, in sports that are played outside, we dehydrate immensely. And just losing about 2% of body weight in fluids can really impact on performance, okay? I'm going to come on to cardiac output and how heart rate variability impacts on this later on, okay? But needless to say, if you're dehydrated, you have less fluid in your system. If you have less fluid in your system, you have less blood flowing around, and as a consequence, you aren't able to perfuse as well, okay? It's a very simple mathematical equation, okay? The other issue with not being hydrated sufficiently is that obviously it's going to affect your electrolytes, okay? So we naturally lose electrolytes when we sweat, okay? And if we're not replacing those electrolytes, there is a higher chance of cramps and so on. So a simple strategy might be, you know, to have a reasonable volume of fluid before exercise, have maybe 150 to 250 mils every 20 minutes of high intensity exercise, and then afterwards trying to replace it. Some years ago, there was a huge debate in the sports medicine community about hydration. And people were saying, you know, you need to take fluid with salts in it, and then carbohydrates, and then you had to take you know, a certain amount of volume every 30 minutes and so on. And then there was a prof from South Africa called Tim Noakes, and he basically said, look guys, we can't prescribe fluid intake during an event so easily, okay? And while this is a, you know, fairly simple guideline, his rule was just drink to thirst, but don't overdrink. Can anyone think of why we shouldn't overdrink? Let's say you're a runner and you're running outside. Do you know what happens? You overdrink, you become hyponatremic, so your salt goes down in the body, and then your brain swells. And this is actually a phenomenon that we see in stand chart marathons and, you know, half marathons and so on. So when somebody comes in collapsed at the marathon, the first thing we want to check is their salt too low? If their salt is too low, then we have to try and replace that as quickly as possible, otherwise their brain keeps swelling. The problem with brain swelling is when the brain swells, it reduces the blood flow. When the blood flow gets reduced, then the brain swells more, and it becomes this whole negative cycle, okay? So we really, really need to get on top of that. I'm going to digress a little bit and move on from nutrition to gut microbiome, okay? Because this is, again, something that I feel is really important in terms of performance, okay? Does anyone have any thoughts on gut microbiome?
Second brain.
Second brain, okay, all right. That's true as well. It is. It does really affect the cognition and everything. Anything else about gut microbiome? Of course, yes, absolutely. And if you've got a good, healthy gut microbiome, it will help with all the absorption of the stuff that we were talking about just now. So what is the gut microbiome? It's basically trillions and trillions of bacteria that's in your digestive tract, okay? And there's about 35 different species, so different types of gut microbia, bacteria that's in the gut. But most of them are from these two groups. You're absolutely right. It's important in terms of digestion, but not just digestion, but also immune function, your whole metabolism. And actually, there's evidence to show that if your gut microbiome is off, it can start to cause issues like joint pain. Okay? So if you are someone who's suffering from chronic joint pain, it may be something to have a look at your gut microbiome. Another thing that we do know is that in arthritis, so if you have rheumatoid arthritis, Crohn's disease, bowel issues, it can affect joints as well. So, it's very, very closely linked, so you're absolutely right. The trouble with the microbiome is that it's very personal, okay? And the reason I put that at the top is, I don't know if any of you have heard of gut microbiome transplants. No? Yes. So there's people trying to basically, for want of a different way, transfer one person's poop to another person and then get the, I know, it's disgusting, right? I mean, I shouldn't have thought of it. But it's very personalized. And the trouble with that is, if I transfer mine to yours, to you, it may not work so well, and vice versa. Okay? So it's a very personalized, very individual proportion. And different areas of the gut have different microbiomes. And the trouble with it is you can't, like I said, transfer one to the other. But there's also fluctuations according to what's happening in, to you as an individual. Okay? This is what you were saying, the gut-brain balance. Okay? So there's a very intimate connection between the gut and how it's functioning and the brain. And it affects our neural pathways. It affects neurotransmitters. And then it's not just neurotransmitters. So the gut doesn't just affect neurotransmitters, but neurotransmitters also affect the gut. And that's why in people who have anxiety and stress, you get IBS, okay, because it's affecting those areas. Now, all of these are important in terms of performance, though, okay? So you imagine if your gut microbiome isn't working so well, okay, if you're having IBS, if you're having, colitis, it's inevitably going to affect your performance, all right? And if you're taking supplements and if you're taking recovery foods afterwards, you're just not going to get the most out of it, okay? So one of the things that you can do is check your gut microbiome. The evidence suggests that actually comparing sedentary versus active individuals, you have very vastly different gut microbia. And in people who exercise on a regular basis, they have a much bigger diversity of the microbiome, and they have a capacity to overcome any issues with it. So what I mean by that is it's a bit like bandwidth, internet bandwidth. Okay, so if you want for a better description, so people who exercise and who are active have a bigger gut microbiome bandwidth, and then they can deal with more stress. Whereas if you don't have a very big bandwidth for your biome, then you're not going to be able to deal with it. So anything that upsets your stomach will really have a big impact on your function. The good news is going from sedentary to active can also improve things significantly. So it's not all lost, but it does take time for that to evolve. A mixture of cardiac and resistance exercise has been found to actively improve the gut microbiome. High intensity exercises have also been found to improve things, and trying to exercise a bit more on a regular basis also has been found. So all the stuff that goes with exercising more actually has a positive impact on microbiome as well. But there's a sweet spot again, as with everything. Too little, you're not going to get the benefits. Too much, it may have a detrimental effect. And so getting that sweet spot is very important. So this is another thing that will affect your performance. What about things like wearables? How does that affect our performance? And I told you I'm covering a whole variety of different things here, and I'm not being too medical about it, but I will try and do a little bit on certain aspects of it. So team sports, GPS trackers, very, very used a lot. You often see sports, athletes put the GPS trackers in there. And what we're trying to look at here is their workload, okay? So not just the distance they run, but if you look at the analysis from the sports scientists, they're looking at the acceleration, deceleration, change of direction, and the forces that are involved in the sport, okay? Now, I know it may not be immediately relevant in the gym setting, but there are accelerometers and trackers that you can use. Let's say for isometric, isokinetic movements. Okay, so you're looking at the strength and the power generated there. So it may not be a GPS tracker, but it's still an accelerometer in use there. Heart rate variability. So all of us who has a smartwatch, I'm sure most of you have a smartwatch, right? No watch. No. Free or for time? Time free. Smartwatch? No. Okay. Smartwatch. I mean, most of us have a smartwatch on, right? And I mean, I don't know about you guys, but I tend not to wear it at night because I whack myself in the face otherwise. But it tells us a lot about our heart rate variability, okay? And I'm going to expand on this in a little while because I think this is very important in terms of monitoring performance and our understanding of it, okay? And then sleep trackers. Well, if you have a smartwatch on, it probably does do some tracking of your sleep. But for people like me who find it a bit intrusive, there's newer things like the Whoop and the Oura Ring. And these are really important in terms of our recovery and our kind of monitoring our performance. So heart rate variability. Can anyone tell me what that is? Or if you have come across it before? Anyone?
How you react to stress?
It's important, yes. Any other ideas on what heart rate variability might be?
Is it under different conditions, your heart rate will be different, and the difference can tell us a little bit about our health and fitness?
Yes, very close. Yeah. So heart rate variability. So let's go to the basics. So when your heart beats, there's a normal sort of pattern to it. Okay. So at one point your chambers contract in one way and the blood flows out and it goes all the way around and then it comes back. Okay. So this is the normal sort of way that the heart pumps and beats. And if we're going a little bit scientific here, so cardiac output, so what the heart pushes out, okay, is a balance between your heart rate, okay, so your heart rate, and the stroke volume, which is the amount of blood that's pushed out at any given time, okay? So it's a very kind of basic mathematical concept, I guess. So cardiac output is heart rate versus stroke volume. Now, to increase your cardiac output, okay, you either have to increase your heart rate and you maintain your stroke volume, or if your heart rate is low, your stroke volume has to go up. So in somebody who's got an athletic heart, okay, your heart chambers will expand and the muscle will also expand, okay, and to get increase in cardiac output when we're exercising or when we're under stress, okay, if you've got an expanded heart, your heart rate response has to go up, okay. So it's basically what's a good analogy? Can anyone think of an analogy? No, I can't. Sorry, off the top of my. Normally I love analogies, but off the top of my head I can't think of one here. But essentially, when we want to push ourselves more, we have to push out more blood and we have to increase the heart rate and the speed of doing it.
I guess I can think of an analogy. So if you want to light
Yeah.
you can either have many more light bulbs,
Yes.
or you can have a much bigger light bulb. So
Correct. Or you can turn it up on the dial, right? Yeah. So you can either turn it up on the dial or you can put more bulbs in the room. Exactly. Same as that. Yeah. So the trouble is, and this is a terrible diagram, sorry. This is heart rate variability. So it's the difference between your ultimate resting heart rate and your maximal heart rate, okay? And what we have found, and what in medicine is found, is that when you've got a very narrow heart rate variability, you don't have the capacity to deal with stress, okay? Now, in medical terms, I guess it means infections or illness and so on. But in the performance setting, it means exercise, okay? So if you take somebody who's diabetic, for example, okay, in diabetics, you don't get that heart rate response. So that's why we have to be very cautious when we're asking somebody who's diabetic, for a long time, to exercise, walk on a treadmill or run or something. Because what will possibly happen if their heart rate variability is low, they won't be able to match that. And then if they can't match that, what happens? They have a heart attack because their cardiac output won't go up sufficiently, okay? So if you have a wide heart rate variability, it's actually a sign of good health. And that's where, I know in a slightly roundabout way I've come to this, but that's where the heart rate trackers and monitors are very useful, okay? Because it gives us that information. And sometimes when you put your watch on or you put your ring on and they say, oh, you look like you're under stress, okay? That's because it's been monitoring your heart rate variability all this time. And then it's picked a point where you are and said, hey, your resting is now here. Normally your resting is over there. You must be under stress. Yeah? So that's how it does it. And so I guess the key is to get regular feedback, to use it regularly. Now, of course, like I said, I'm not a fan of wearing it when I'm sleeping because I can't tolerate it. But if you can get something that gives you that information when you're sleeping, then you get your absolute resting basal heart rate, okay? And then after that, you can build a pattern for that individual. And by building that pattern, then you can start to identify when things are going wrong, okay? Another important aspect of wearables and in terms of performance optimization is looking at load, okay? So load and extrapolating there in terms of injury prevention, okay? I'll come on to this acute to chronic workload ratio in a little while, but basically it's looking at your acute load versus your chronic and looking at a specific ratio to see whether you are pushing yourself too much or not pushing yourself enough. But one of the things that you can use very easily, and now I think it's becoming more and more within the means of clinic setting as opposed to a biomechanics lab setting, is biomechanical analysis. So a couple of weeks ago, I was privileged to go to Aspetar. I don't know if you've heard of Aspetar. Heard of Aspetar? So yeah. So it's in Doha, and it's basically owned by the king of Qatar, I believe, and he's basically pumped lots and lots of money into it and developed this beautiful center. And a lot of the footballers from PSG and different, EPL teams come and get treatments and everything there. So it's a fabulous center. It's really like next level stuff. And this is their biomechanics lab. Okay. So when we're talking about doing 3D analysis and everything like that, what these guys do is they basically put markers on these athletes. They have lots and lots of cameras around, and they're looking for movement patterns. I mean, this is next level stuff. Okay. This is like, it's not amenable to the most of us, okay? But actually, we do have lots of alternative wearable technologies available to us. We have, our phone, for example. It's got a triaxial movement It's got a gyro in it. So we can have a look at what our movement, movement patterns are. There are wearable modules that you can attach onto patients with straps and everything. And this gives us information about movement patterns as well. So in terms of athletes and movement, so I can see somebody doing a lunge over there in the gym, okay? But you attach these movement sensors on, and then you have a look from a kind of biomechanical perspective. You get a lot more information than sometimes just visualizing. I mean, it complements what you're doing in terms of visualization. And then we come on to the emerging stuff in terms of technology as well. So blood biomarker analysis, actually this has been adopted a lot in very elite sports. So what we're trying to do in elite sport is we're trying to build a pattern again for that athlete in terms of what their norms are. Can anyone think why?
So that you can tell when something's abnormal.
Why? What might that naughty person have done? They might be cheating.
Doping.
Yeah, doping, right? So it's being used more and more to try and develop a pattern of that individual in terms of cheating, in terms of doping, and illegal methods of performance enhancement. Okay. To go with that, actually, there's a lot of AI and learning happening in sports and sports science now. Okay, and one of these things that we tried to do recently was look at it in footballers. So a colleague of mine from Republic Poly and we developed a AI model to look at injury in footballers. And we tried to get data from our local footballers to then take that and extrapolate and try and predict when they might get injured. Unfortunately, the issue with the local football scene is the local football scene. And no, that's a joke. Sorry, that's a bad joke. We don't get enough data, basically. The data collection has to be very accurate, and we need a big pool of data. Okay, but I think there's definitely a lot of interest, and particularly for some of the European teams or the American teams, where they're pumping a lot of money into the player performance and welfare. Okay, they really want to keep that individual performing to their optimum rather than having to deal with things once they break down. So by using these kind of models, it's becoming better in terms of predictive. And then the last part, I guess, in terms of the performance and optimization is the whole psychology of it. Now, I don't know why I put it at the end, because maybe it should be at the beginning. I don't know. But I guess you think about all these other things and you think, oh yeah, psychology as well. But maybe actually psychology should be at the beginning. And maybe I'll change it if I do this talk again somewhere else. I'll put psychology right at the beginning and then deal with all the other things that can happen. But psychology, as we know, very, very complicated. Looking at mind stress, mindset, stress, and this will invariably impact on performance as well. How the athlete interprets stress and load and how they then perform will play a huge part in whether they can do what they're meant to be doing. But there's also some medical things that can play a part as well. So if they're under stress and they're not performing, maybe looking at cortisol levels. Okay, so their morning cortisol level, is it too high? Are they, is it pushing their blood pressure up? Please come in. These are things that we should also look at. In athletes who are unfortunately suffering from mental health issues, we do know that there is a higher chance of them injuring themselves. But psychological interventions such as imagery. So I don't know if you've ever watched rugby, but when they're going to do the spot kick for the after the try, they're going to kick the ball in over the things. They often stop and they're visualizing. So trying to kind of put those into sports and well-being is very important as well. So there's a whole lot of stuff that goes on in terms of psychology and mental aspects, but I won't pretend to know everything about it. I've been privileged to see some of it. I know that in some sports, the psychologist travels with the athletes as well. So in the recent WTA event that we had here in Singapore, they have a dedicated psychologist for the players, 24/7 throughout the week. So, it does really play a part as well. And they use all these kind of skills to try and optimize the athlete's performance. And this is quite an old paper, but it gives an understanding of why the athlete might, from a negative psychological perspective, then start to have issues in terms of their performance. So if you have a performance stress, psychologically they're okay, the training, they can see the gains, and then they maintain it. And they just basically keep going through the cycle, okay? Whereas if there's any negativity that comes in, or the training plateaus, and things kind of level off a bit, then you can either go one of two ways. You try and maintain this and it just kind of teeters off and they don't really perform. Or they say, hey, what's going on? I'm not getting what I want to achieve. And then they start to go into this phase. So picking this up early is really important. And maybe it's, in this situation, it's about having SMART goals. Making smaller gains and encouraging them that, hey, look, you've made this, let's go to the next one, rather than say, oh, well, I haven't made the progress that I have, and that's already that negative psychology that's in there. Okay, so that was a little bit of a whirlwind in terms of performance optimization. Does anyone have any questions about that at this point? I really have stayed away from anything medical, talking about iron or supplements and all of those things, but I've tried to give a very broad dash on other things. All good?
I've got one question. So what are some ways we can, or like some things we can vet or adopt to increase or get our gut microbiome better?
Okay, so if you're doing it from a purely medical way, now I'm medicalizing this one, what you need to do is establish what your gut microbiome is first, okay? And for that, you need to do a poop sample, okay? So they send it off to the lab, they give you a breakdown of your microbiome and everything like that. The next thing that I would do is then try and match it to what problems or symptoms or whatever's going on. Are you having any issues with going to the toilet too often? Are you not absorbing carbohydrates? Are there certain meals that you take where and it's causing an issue for your gut and everything? And trying to address those, okay? And then after that, it may be about looking at specific microbia to try and improve things. Now, unfortunately, I don't have the experience of doing that part, but up to that part I can help you with. Yeah, that is very, very specialized. And again, like I said, doing the microbiome transfers and everything like that, it's quite niche. Yeah, but that's how I would suggest you approach it.
Would supplementing with a probiotic?
You can try it. Yeah, it helps some people. It doesn't help other people. But remember, it tends to be a very narrow bandwidth type of bacteria, so lactobacilli or something like that. So it doesn't help everything.
Okay.
Yeah. Actually, the bigger impact on gut microbia, and I didn't really cover it in depth, is things like the diet that you eat. Okay, so having fiber in the diet, that's very, very important. Obviously, it goes without saying, what your mum always told you, green leafy vegetables, and vegetables have a huge part, and actually they improve the gut microbiome. And then just having a regularity to bowel movements as well. Because if you are somebody who suffers from constipation or sluggish bowel movements, that's going to affect it as well. So there's little things that you can do to improve it without necessarily going down that medical route. But if you really want a detailed analysis of it, then I would recommend that. I know there's some primary care doctors and different people who have an interest in it, but it's fairly niche still. Yeah. All right. Okay. So injury prevention. Big thing in sport. especially in the elite sports setting, you're trying to keep that athlete involved in the sport as much as possible. And let's say you're paying them $100 million or however often. It's really important that you keep them in that sports setting and contributing. Again, biomechanics, load management, training, and recovery are all very important. The generalized adaptation syndrome is very much similar to the bits that we talked about before. So I'm not going to go into that, but I am going to talk a little bit about this acute to chronic workload. This was something that was developed by a guy called Tim Gabbett, who's a physiotherapist, I think, in Australia, and then he did his PhD around this. And then it's something that I think is very useful, particularly when you're in that sports and training setting. But this is basically how injuries happen. And again, it's a very old diagram, but it's very relevant. So we all have intrinsic risk factors, okay? It could be, as we get older, we could have had an injury, an ankle sprain or something like that, and we don't have that neuromuscular control. It could be an issue with strength. And so you have, in this situation, somebody who's predisposed to getting an injury, okay? When they start training and everything, for the majority of the time, they keep going around in this cycle. So there's events that happen, so they play sport, they train, no injury, and they keep going back here. But sometimes there's something that happens, whether it's they're lifting a weight and suddenly their wrist cracks or something like that, and then they start getting pain, or they get tackled the wrong way, and then they get some sort of injury. And once you have that injury, hopefully you recover and you go back into that adaptation cycle, but sometimes, of course, unfortunately, they don't. So there's a whole bunch of different things that can be risk factors. Like I said, age, gender for some risk factors as well, body composition, your biomechanical alignments, and again, whether you're comfortable in doing that sport as well. There are other external risk factors, so intrinsic and extrinsic. So the people you're playing with in terms of the sport. If you have protective equipment, it could be the environment that you're playing in. So if you're somebody who's training for a marathon in the cold weather, and then you come and hope to run a marathon here, there's a higher chance of you having an issue here, right? And vice versa. And so we have these inciting events, and for the most part, people just kind of go in this cycle. But when something happens, that's when we develop injuries. So this is the acute to chronic workload ratio. So we have training, we have a specific load, there's a response. Either they go to fatigue or fitness, okay? And then that's where the performance, injury, and monitoring comes in. And this is, I guess, the role that you guys play, right? For the most part, we want fitness. We want them to be here. But sometimes this will happen. And picking this up early is really, really key. So what is this acute to chronic workload ratio? So training load can be divided into two categories, external load and internal load, okay? So external load is basically what that person's doing in the gym. So they're doing a good morning, they're holding the weight and they're lifting up, and however much the weight they're holding is the external load, okay? But the internal load is how your body responds to that stress, okay? So how your body responds to that stress is either your heart rate, if let's say you're doing endurance sports or whatever, or it could be your RPE. You've come across RPE before? Yeah? So perceived exertion, okay? And so this is your internal load. Now, this you can monitor and you can get objective values from it using some of the cardiac stuff that we talked about earlier, so the performance stuff. So it does play a part as well. So, like I said, EL is the total distance or the number of sprints or the weight that you've moved. IL is the RPE or any scales that you're using. And sometimes what happens is someone will do the same load, external load, but their internal load may be greater or lesser than somebody else. Okay? So the ACWR, the acute to chronic work ratio, is basically the acute load of last week, so what you were lifting and what you were doing, okay, over the chronic workload over the last 3 to 6 weeks. Okay. Ideally, in a sort of acute sort of setting, with the acute when the acute workload is greater than 1, there is a theory that your risk injury goes up. Okay, but equally, if the chronic workload is significantly more, while there's less risk of injury, you may not get the adaptations that you want as well. So again, it's about hitting that sweet spot, that balance between acute load and working out what you have done over time. And I guess what it amounts to is periodization. Yeah? You've come across that a lot, right? I'm sure you all have come across that. About if you have something coming up, what are you focusing on? What's your goal? And how are we going to get you to that goal? So is it you're running a half marathon next week? Okay, well, that might be a bit short notice. But if you're running that in 3 months' time, how are you going to build up to that? When are the recovery periods being put in? What's the nutrition that you're going to have to kind of think about as well? Okay, and we don't want to overload too much because there's a higher chance of breaking down, right? There's a higher chance of fatigue. There's a higher chance of injury. But equally, we do need some stress to get you there. So again, I mean, these are very basic things that I'm sure most people are doing all the time. The warm-ups and the cool-downs, okay? So the post-activation potentiation, so getting the nervous system, getting ready for activity. So one of the things that you often see is in the gym particularly, is people will kind of say, oh, well, last week I lifted 20 kilos, and they jump straight to that, okay? Whereas one of the simple things to do is start off at half of that, warm up with that, and then go on to the heavier loads after that. So you're kind of preparing your body in readiness for the heavier loads, okay? And another example would be, the football again. So what they're doing is they're building up gradually to the football match, okay? So often players come in after their warm-up and they look like they've played a full 90 minutes, okay? But they haven't played 90 minutes, they've just got ready for that game. Dynamic stretching versus static, I'll tell you, I'll give it over to you guys. What do you think is the best one? Dynamic? Yeah, I believe so. I mean, static stretching, but why?
So, as far as I know, dynamic stretching doesn't reduce our muscles' ability to produce force, or basically our strength. It doesn't affect our strength. And so, it's not going to be a detriment to performance, whereas static stretching might.
And I think also with dynamic stretching, you're progressively increasing that stretch. Okay, whereas static tends to be, oh, I've done a stretch, I've done a hamstring stretch, okay, I'm ready to run type thing. Whereas if you progressively do the dynamic stretching, then you'll get to the elongation of that muscle without necessarily putting a excessive stress on it.
I do have a question though. So with static stretching, what I understand is the goal is to reduce the force on the tendon by elongating the
Muscular tendinous junction.
Yes. Which would reduce the force on it in strength training. So would there be an argument to still do static stretching prior to training?
Ooh, that might be a bit high level for me.
Okay.
Sorry, I'm going to have to tap out of this one. I mean, everything needs stress to adapt. So I'll go to the basics, okay? Tendons as well as muscles need stress to adapt. So if you do a lot of concentric training, okay, you'll get hypertrophy of that muscle, but you may not necessarily adapt that tendon. The tendon actually tends to do better under eccentric load. That's why, when somebody's got an Achilles tendinopathy and things like, that's why we, the whole thing about the eccentric loading and everything was started off, okay? But if you're stretching in a static way and you're just kind of holding it there and you're not sort of putting it under that repeated dynamic load, then you're not going to be eccentrically loading it at the same time, right?
Yeah.
okay?
Yes.
So I guess you do need a bit of static stretching, but you also do more. I guess it depends on where in the exercise you're doing it.
Okay.
Yeah, if you've warmed up and then you can do more dynamic stretching. At the end of the exercise, maybe more static stretching. Yeah, but both do need load to improve. So, as we mentioned already, the acute to chronic workload ratio, and then obviously, not maintaining that same level of intensity up to the event. So you have to taper off a little bit before. So even and I guess most of my experience is coming from working with football. They'll have periodization within that week, and they'll have an overall periodization as well for what's happening in the season. Okay, so you do need that recovery time as well. One of the big things that a lot of athletes are doing now is obviously incorporating strength. Okay, so back in the day, footballers would just go and play football and that would be it. But actually now, more and more, they're doing a lot more in the gym as opposed to previously. Okay, and the whole thing about rest and recovery, I mean, it's a given. You do need that, and it does need to be built in a lot more. And if you can strategically, then I think it does improve your risk of injury. This is something that is, again, very, very old. It's 1992, okay? But there was I think he's from Holland, I think he's from Holland. There's a professor of injury prevention. And basically he said, to me, this is our role as healthcare professionals, or if you work in the gym and, you've got clients, this is what we should be looking at. We're trying to, does it come across? It does, right? Okay. What we're trying to do is we're trying to identify why the injury is happening and how can we prevent it. So in the overall scheme of things, what we're trying to do is look at how often this injury is happening. So I'll give you an example. If you're working in the emergency department and you see a whole bunch of kids coming in from a particular football field and they've all got ankle sprains, you should be like, oh, something's going on a bit funny there, okay? And then you need to ask the kids, hey, so what happened? Oh, the ball went over the ditch and I jumped across the ditch and then I landed on, something and I sprained my ankle, okay? And so then what we're trying to do here is we're trying to look at ways that we can prevent that from happening, okay? And then by having instigated or implemented that preventative measure, then we want to go back and have a look and see what's happened. So I'll let you think of things that may be happening in the gym setting or in the exercise setting that may be relevant to you. But if, let's say, for argument's sake, your clients have started developing forearm pain or tennis elbow from a particular exercise, is it the way that they're doing the curl or the lift or whatever? Is there some way that you can modify it? So implementing that change is important, and then after that, reevaluating and saying, hey, has it got less? Have less clients developed it? And really, as healthcare professionals and people who are in that sort of sports and exercise environment, I think we do have a responsibility to play with that as well. Okay, thank you very much.
Thank you.
Any questions?
I have a question.
Yes.
What are your thoughts about using the cold packs like injuries?
Okay. Oh, that's another one there's a lot of debate about, right? So, okay. So traditionally, as soon as anyone got a sprain or a strain, the first thing that you see is you put ice on it, right? And what you're trying to do is you're trying to restrict that blood flow and everything, and try and stop that swelling and minimize it. Over time, we've come to realize actually we may be inhibiting healing. Okay, so that whole inflammatory process is actually really important, not only to protect the area, but also to increase the blood flow, to increase the the macrophages and the white cells, and create that inflammatory response, because that's how healing gets started. Okay, and now I think the theory goes that within the first 48 hours, you almost kind of want to encourage the inflammatory process, and then after that, slow it down. Because there's a sweet spot to be hit between the protective and the good elements of that inflammatory process versus the chronic okay? And once it starts to get prolonged, that's when you start to have problems with dysfunction, muscle atrophy, and so on. So it's a tricky one. I don't think I have a perfect answer for it, but my answer would be maybe in the acute phase you want that inflammatory process, but you don't want it to be prolonged too long as well. Yeah. Is that all right?
Is the problem with it being prolonged for too long just discomfort, or is there something else that's
Well, it's okay. So if you had a mosquito bite, right? Okay. So when you have a mosquito bite, you itch, right? But if, let's say, the itching continues, you keep itching it and you keep itching it, and what happens then? You start getting thickening and scar tissue and everything building up the wrong way, okay? Whereas in the initial phase, it's protective. It's what's happening is the blood flow is there to try and take away the toxins, whatever the mosquito has put in, and that's the protective part. So if it continues too long, then you get the detrimental parts of that inflammatory process, like the scar tissue, like the limitation in movement, like the muscle atrophy. And so that's really the why you don't want it to prolong. Yeah? Hello. Cracking sound. So there's a lot of different reasons for cracking sound, okay? Probably the commonest is if the cartilage is a bit worn out in a particular joint. But also, let's say, for example, you have an inflammation in a particular area. So in your arm, the tendons will move under the bone, okay? So if it's swollen up, then it can cause a bit of a crunching feeling and a cracking sound, as it were. And then, like we were talking about just now, if the inflammation has become prolonged, and then you get a buildup of scar tissue there, what will happen is that in itself will create a thickening, and that in itself will potentially cause the issue. So there's a lot of different reasons, but it's usually that there's some sort of inflammation or chronic process potentially going on there.
So is that something we should be avoiding? Like if a movement produces clicking, we should...
Not entirely. So if there's it may be that a particular area has had a previous injury and it's not as tight as it was once before. Like an analogy is if you blow a balloon up, okay, the first time you blow it up, it's bloody hard to blow it up, right? Second time round, it's easier. Third time round, fourth time round, it's easier. And that balloon gets a bit saggy and loose, right? So if you've sprained your ankle, what will inevitably happen is that the ligaments around it that are holding it together will be looser. And so there may be a point where that joint is subluxing a little bit. So it's just kind of like moving a little bit out, okay? Now, that in itself is probably not, it's not ideal to have that, but it's not terrible in, say, day-to-day situation. But if you're getting that and it's becoming worse, if you're getting pain with it, and then it's predisposing you to further injury, then I think that's when there's definitely a problem. And that certainly warrants looking into. Yeah. But clicking by itself, yeah. Trust me, you start to click more after when you hit 40 as well. So, I don't know, 40? Yeah, it clicks more, right? Yeah, I know. Yeah, sure.
You mentioned cartilage earlier,
Mm.
so just want to see if I understand correctly. Cartilage is something that can't regenerate. Is
Oh.
that correct?
So cartilage is basically like on the top of a chicken bone. You know, if no vegetarians here? Anyone vegetarian? No? You all eat chicken? It's a fair question because I once gave this talk. I asked that question and everyone was vegetarian. So, so if you on the top of a chicken bone, you have that smooth, shiny surface, right? That's the cartilage. Okay. So there are certain areas in the body where, well, in most areas of the body, you have a bit of fluid between the two the two bones, and that's what that allows it to move a bit more freely. In certain areas, there might be additional support for that cartilage, like the meniscus and the knee and so on. Now, if your cartilage is getting damaged, okay, first and foremost, you need to try and understand why. Is it from muscle tightness? Is it from laxity of the joint and so on? If the cartilage has got damaged, okay, there's usually a progression to it. So if you imagine this is cartilage when it's nice and healthy, it's nice and smooth and it's complete. And then when cartilage is getting injured, you'll get little cracks appearing in it. And then these cracks get bigger, and then you get the ulcers and so on. And it's easy to deal with it here, okay? It's harder to deal with it here. But cartilage can be improved, okay? And there is some theory to say that you can either slow down that wear and tear of the cartilage or even encourage it to improve a little bit through various treatments. So I was just recently doing a presentation for PRP and hyaluronic acid and things, and there's some papers that say, hey, after doing the PRP for knees, the cartilage does seem to improve.
Sorry, what's PRP?
Platelet-rich plasma. So where you take your blood, you take the plasma and the platelets, and you inject that in. So there are some studies which say that they found improvements in the cartilage after these treatments. Of course, doing an injection to the knee and trying to improve the cartilage that way is much easier than going down a more surgical route where they have to obviously go in and so on. But even through surgery, they can do things to try and improve that cartilage, like microfracture and so on. Now, I'm not a surgeon, so I can't tell you all the intricacies of that. But I was reading something recently that in the US, they've developed this gel plug that you can plug into the holes in the cartilage. Yeah. So they're really kind of trying to do more restorative things now as opposed to replacements. But a basic thing is trying to pick something up early. So if you are getting crunchy knees, pain in the knees, in the joint and so on, and filling it with the healing factors from things like the PRP and the gels, and trying to kind of encourage it to heal that way. Yeah. I don't know if any of you have come across PRP before?
Yes, but I think the issue of this, like, you cannot say for how long it is going to last, and again, not for
True.
everyone.
True, absolutely.
Patients like 2
Yes.
months, some patients 1 year, and they are
Yeah.
fine. And also, we're not going to adjust like physiotherapy and exercises, so it can be better just only for a couple of months, and again, not changing the biomechanics.
Yep.
Can get imperfect.
I think the you're absolutely right. We don't know how long it will last for, okay? Because there's an individuality to it. My PRP is maybe not as effective as yours, as effective as anyone else's. But the advantage of it, so the purpose of the PRP is threefold. 1 is to reduce pain, 2 is to reduce inflammation, 3 is to try and encourage some healing of that area. In practice, I usually combine that with the gel, which has the cushioning sort of properties as well. But essentially, what I find is that you buy yourself a window where you can try and get the biomechanics right, you can get the strength right, you can get the movement patterns right, okay? And the advantage of the PRP, it doesn't have the side effects that steroids have, okay? And if it staves off that, if it delays that need for surgical treatment, where we know that you develop scar tissue, muscle atrophy, and all those other things, then actually, on balance, it's not so bad. Yeah. So it's not perfect. I grant you that, but it's a darn sight better than doing unnecessary surgeries. Yeah. And there is evidence to say that actually, some people go for the single PRP, they feel great, and then they don't do anything after that. They don't even come for rehab or anything, right? But actually, the evidence suggests that, let's say for argument's sake, your knee, between 2 to 4 injections is optimal, and they do have kind of guidelines on when to do it and how to do it and so on. So, yeah. PRP is platelet-rich plasma. So you take your blood, you spin it around, okay, and then it separates out to the red cells and the liquid. And in that liquid, you have these little fragments called platelets. And platelets are basically, when you cut yourself, the hole gets plugged with platelets, okay? And these things have lots of healing factors and signaling factors in which try and encourage an area to heal up. Yes, correct. Yeah. 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 PRP. Platelet-rich plasma. Rich plasma. Yeah. Yeah. Sorry? No, no, it's an alternative to steroids. Yeah, I mean, no steroid, no, no. Yeah, yeah, yeah. I mean, I'll give you an example of a recent PRP treatment. So this is n equals 1, so please don't think this is a study or anything like that. But I had a patient who had hip pain and basically was unable to sit down, okay? They were unable to sleep, and they had this going on for about a month. We did an MRI scan, and there was a labral tear, there was cartilage injury, and basically just, it sounded like, because, you know, if you went and saw one of my colleagues from surgery, they would have said, hey, let's do a scope, because, you know, there's lots of things to repair in there. So patient didn't want to have surgery, and instead they opted for a PRP and so on. So did the PRP. First couple of days they said, oh yeah, the hip felt a bit tight and swollen and everything. But 6 weeks down the line, I'm back to running. So that was my hip. And that's my own experience. So, you know, as far as possible, I'm not going to have surgery on my own left hip. So, yeah.
You were saying that some of these patients after 6 months may not be the one to go for surgery, but use this method still can get.
The patient was me.
Oh,
It's me, yeah. And 6 weeks I got back to running. So 6 weeks, yeah.
So how about the tech?
I mean, I'm not, you know what, it's not painful, I don't care. You know, I can get back to running and swimming and whatever I can. So
Initially you got hair, then you MRI scan, you got hair, you got
correct.
what
I got like some cartilage injury there as well. Yeah.
and also the hip pain or knee pain.
Hip pain, I couldn't sit down like you're all sitting in the chair. Yeah. So
After that, how many rounds of injection?
I did 2.
So every time you go to that place, you immediately draw the blood, is it?
Yes.
And then wait for some time or
It usually takes about an hour to do in total.
after that immediately, after an hour you wait there, they will inject for you.
Yes.
Is it very painful, the needle?
No, it feels like a bit of an ache in the hip, and that's it.
The needle, is it those long needles?
I mean, it's the same as a blood test needle. Nice to see you again.
It's same as taking blood, those,
Yeah, yeah.
not those like long, very,
No.
the normal injection needle.
Yes.
Okay.
Yeah. So yeah. So that was my experience. So there you go.
The lapse of time is how long?
Sorry.
You go for the first round,
1 month apart.
so another round is second round.
Yeah.
So after second round, you already,
Yeah.
the first round you already.
I mean, first one I felt so much better within a week, but the second one I did because I wanted to get more out of it, and I definitely didn't want to go for an op. So yeah. Any other questions? No. Yeah. My oldest patient this year was 92. He was a surgeon from Israel who came to visit his son, and I did it for his knee before he left. So yeah.
Are there any conditions which doesn't allow a person to go to that?
Not an absolute, but a relative one might be if you have an infection in that area, and secondly, if you're on antiplatelets. So like if you've had a heart attack and you're on aspirin. So it doesn't say that it doesn't mean you can't do it. You just have to be off it for a few days before you can do it. Yeah, that's all.
Per area, per dose?
How much blood?
No, how much does it cost?
Oh, it depends. It depends on. There's many different nuances to it. So in the sense that there's PRP by itself, there's PRP with a gel, there's PRP that you activate. So there's lots of different variations to it. And furthermore, it depends if you do it in clinic or whether you do it in the surgery setting on your insurance and things like that. But needless to say, we try and always keep things cost neutral as much as possible. Sorry.
It's not covered by insurance, like in your case, the hip,
Uh-huh. Yeah.
this one is a non-surgical
Yeah. So in 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 private practice, the prices vary wildly. Okay. For in my practice, if I do the combined one, it's about 1,008. Okay. But I know there are some doctors charging upwards of like 5 or 6,000 for the same thing, which I think is not right. In public hospital, I know they do the basic PRP, which is about 1,000. Yeah. So without the gel and everything like that. So yeah.
Is it insurance covered? Okay, fair enough.
Yeah. No, I mean the insurance. It depends on your insurance.
Right.
Like it depends on what coverage you have. It depends on all those things. I found that some patients from Europe, their insurance they are very happy to cover it and everything. So, and to be fair, in all honesty, I mean, I could have the options I had was to go for a scope and surgery on this, or I could have done that, and I did that, and I've saved my insurance company about $40,000. Because it costs a fraction of that. So.
They allow you to pay for yours, was your insurance local? You bought it?
Yeah, they did. Yeah. So it depends on which policy and what coverage you have and all those things. So.
So, sorry, one question. Prior to having this injury in the hip,
Yeah.
were there any like telltale signs? That was
Nope.
like
I
one day you just couldn't
literally, I was literally sitting at my desk one day and I was like, oh, that's a bit sore. And then it just kind of went from there. And to the point where literally I was driving the car and I was sitting like this in the car and driving because I just couldn't flex this hip. It was ridiculous. And I did everything. I did like hip flexor stretches, back, I did glute work, I did the whole lot like myself.
What about like right now, like this process? So you clearly recovered.
Yeah.
Are you like supposed to exercise then?
Well, the aim is to get you back to exercise, I mean, that might, so when patients see me and I do these things for them, I have two golden rules when it comes to these injection treatments. One is that you need to offload for at least a week to 2 weeks. That's a given, okay? Because you want that area to recover. The second one, especially with the PRP, is we don't want anti-inflammatories because we want the platelets to come together and release and things like that. But if, let's say, I did your knee right here and now, we would be talking afterwards to say, hey, I expect you to do upper body, core, get in the swimming pool in 2 or 3 days' time, get on the exercise bike. The aim is to try and get you back to activity in a much shorter time period.
So it'll never be in a case of you should never exercise after this.
No. And if there are things that you do that, somewhat flare it up a bit, going back to, what he was talking about, the ice and resting and offload, so yeah, those kind of things. Yeah.
So what is it about training that regenerates the cartilage, and what is it about training that could slow down the degeneration?
Ooh, okay.
That's
Huh?
a good question because I also want to ask because I love squats.
Uh-huh.
I love doing heavy squats.
Okay.
But not like every week, so I'll do it like every second week. But
Okay.
you kind of want to like push yourself, but I also don't want to
Injure yourself.
mess up my knees or
Yeah.
something like that over time. Not an immediate injury, but like over time when I'm getting older. Yes.
So I think actually load is normal. Yeah, we should be putting load through our bodies. And actually, worldwide, there's this huge pandemic of, I don't know if you've kind of heard of it, phenomenon called sarcopenia. Have you come across that? Okay. Muscle loss, yeah. So muscle loss traditionally it was described in the elderly population, so in people in their 60s, 70s and above. But actually now we're seeing it in people in their 30s. Okay, it's really worrying, right? Because sarcopenia we know is associated with chronic disease, so blood pressure, diabetes, all those kind of things. So actually, load is important, okay? Now, how do you do that load without injuring yourself? It's about doing the thing right,
Yes.
okay? So it's about looking at that acute to chronic workload, not pushing it so far that you're always in that acute phase, but you do have time for adaptation and recovery and so on. It's about getting your biomechanics right, okay? So if you're doing squats and deadlifts, you know, looking at from your feet upwards, you know, are you placing your feet correctly? Are you, you know, putting excessive load on a particular area of the joint or not, okay? Often is the case we wear certain sports shoes for certain things, and then we get lazy and then we just use those same sports shoes for other things. But actually, you know, we all know in sport that if you're doing heavy loads and lifting, you need much more stable shoes and not the running ones, okay? So it's about addressing all these little factors and trying to prevent injury from that regard. Now, if, let's say, for argument's sake, you start to develop symptoms, so you start to, you know, you're doing a deadlift at one point and you get, that ache in the knee, or you get, sudden sharp pain or something. The important thing at that point in time would be not to ignore it, okay? And unfortunately, what a lot of us do, and, you know, I guess even for my hip, I thought, nothing of it, okay? And I thought maybe I can work around it and everything. But it got to a point where I was like, you know what, it's not settling down despite what I'm doing. It does need looking into a bit more. And catching things early, so maybe my hip, it's been something that's been building up over a period of time and I just hadn't noticed it, okay? But let's say you haven't had any problems before, absolutely none, and you get sort of sharp pain when you're doing a squat or you're bending down to tie your shoelace or going upstairs, you know, get that looked at into early, because like I was saying before, there is evidence to say that using these treatments early, you can try and slow down that process, and not only that, but you might be able to recover it as well. So it's kind of not the perfect answer, but it's how I would approach it.
Okay, yeah, because I was just worrying about like load. So
Yeah.
if you're approaching like almost double your body weight,
Mm-hmm.
then I was like,
I don't think it's specifically about the load itself. It's about how you're lifting the load, about your biomechanics, your stability, and all those other intrinsic muscles that you need to work on to be able to cope with that load. So let's say around the hips, you know, your piriformis, or your glute med, or your glumella, or the stabilizers of the hip. You know, doing all the exercises for those to make sure your hips are nice and stable, and then the big muscles can do what they're meant to do. I'll give you an example. So recently I've been doing a lot more work with back pain, okay? And doing more work with back pain, there are certain factors in the back which are very, very important, but are not necessarily considered. So one of them is the ligaments in the back, okay? So if your ligaments aren't holding things in place, and they're not tight, and they're not, restricting the excessive movements, what do you think would be the thing that stops it from moving? The muscles, right? Now the trouble is, the muscles are there for a particular reason, for movement, okay? Maybe part of it, maybe it's an 80-20, 20% of the time stability, 80% of the time movement. But if the ligaments aren't working, then the muscles have to take more of that load. By virtue of taking more of that load, it goes from maybe 80-20 to 60-40 or wherever, okay? And as a consequence, then something happens and the muscles go into spasm, because they're like, hey, you know what? I've had enough. I'm just going to go into spasm, and then I'm going to, and then what that then creates is inflammation around the back, and just a whole cascade of things that go on, right? So again, identifying things early is important. Then you can try and remedy it. You can try and repair it without having to get to the stage where you're having to do spine fusions or disc treatment, all those kind of things. Yeah, just I think my perspective is slightly different to other sports physicians, in the sense that if you come and see me and you've got a sprained ankle and you've got, tears of the ligaments or whatever, I'll be like, yeah, you need to go and do rehab, but at the same time, let's do something regenerative to try and get it to heal better, and then we can kind of get you back sooner, rather than, wait 6 weeks, 6 months, 6 years, or however long, and hope that things get better just by themselves.
So just to clarify, what I understood from that was, if Georgia is squatting properly,
Yeah.
She's moving her joints in the way they're supposed to move,
Yeah.
everything's strong,
Yes.
and she's with that ratio working with a workload that is not so much more than the past 3 weeks,
Yes.
it should be healthy for her cartilage.
Yes.
Only if something is
Happens.
wrong, that's
Yeah.
when she should do something about it, which is either seek medical treatment.
Speak to somebody who can assess it for you, right? Whether it's a physio, whether it's someone like myself, see what the issue is and understand what the issue is. Quite often is the case, and when I speak to patients and we found out what the diagnosis is, I say to my patients, look, you can tell me to stop here and be happy with the problem and just work around the problem, even if you want to, right? But if you're doing all the correct things, there shouldn't be an injury, right?
So if it's all done correctly, it's
Yeah.
healthy for her.
Yeah.
Okay. And so what wears away cartilage? Why does it?
So it's usually there's usually some kind of trauma, okay? So some kind of impact, sometimes these things are when we were kids, we fall down, we'd bang our knee, we don't even notice it, okay? And then over time, it goes from here, it's nice and smooth, to a very small crack, okay? Now, when that crack happens, you may have irritated the knee sufficiently to inactivate a certain portion of, say, your quads, okay? Now, if your quads aren't firing sufficiently and moving everything in the groove, okay, in the groove that it's meant to go, then it's a bit like, if you have a door, right, and you have a little bit of a flooring that's up on the door, and it keeps rubbing like that, it keeps rubbing, and eventually it's going to wear away at the door, right? Yeah, and that's effectively what happens in the knee. Okay, so it's usually from something small like that. The other thing is that it could happen because you're putting too much pressure constantly on the knees. So from obesity and other things as well. No.
So I know of a lot of people who say that they've worn away their cartilage running. So would that be impact-induced cartilage degeneration?
I don't think running is the root cause. It may be that something happened during running, okay? Or that again, maybe biomechanically there's some issue or strength issue, okay? So as we get older, one of the things I say to a lot of people who run and come and see me, it's like, in addition to your 40 kilometers a week or 50 kilometers a week, you need to be building in strength into it as well. And that's really, really important, okay? There was a study that I read some years ago about distance runners, and if you incorporate strength training into your distance running programs, it actually improves your efficiency a lot, okay? Because you're able to generate more power. Whereas if you're somebody who just runs, yes, you'll be a very good runner, but you may not be able to generate that kind of power and everything. Good. Any other questions? We're good. Thank you very much.
Thank you so much.
You're welcome. Thank you.